Hello everyone, my name is Vinay. Welcome to my channel LifeLearn. Today we are going to discuss about an unusual side effect of a COVID-19 vaccine. Before going to discuss the side effect of AstraZeneca vaccine, we'll discuss a little bit introduction about the AstraZeneca vaccine, how the vaccine is prepared. AstraZeneca vaccine is an adenovirus vaccine. Adenovirus has a double-stranded DNA as its genetic material, and when they use adenovirus vaccine, and this is chimpanzee adenovirus vaccine, chimpanzee adenovirus, and adenovirus has double-stranded DNA as genetic material. This is a typical adenovirus, and this adenovirus, when enters in our body, which is used as a vector for delivery of the vaccine, this cannot grow by itself. So what they do, they just mutate the original adenovirus and they replace its replicating part of the DNA with the coronavirus spike gene. We all know that coronavirus has spike protein. This is spike protein, and this protein is important for its entry into the cell. So, and also we know that it has mRNA or RNA as its genetic material, and they identify one part of the RNA which is responsible for the production of this spike protein, and they take this part and they fuse this part with adenovirus DNA. From RNA they make the DNA, and then they fuse this DNA into the adenovirus DNA. After the fusion, they take this virus and inject into muscle cells. This is a kind of muscle cell. This is the nucleus. When the virus enters into the muscle cell or any kind of cell in your body, it injects its DNA. Its DNA comes out, which contains spike protein gene. Then this DNA produces spike protein. This spike protein creates antibody in your body, so we can get the resistance against the coronavirus. After the mass vaccination of AstraZeneca vaccine in around March 2021, some reported that this vaccine created blood clotting, an unusual side effect which shows blood clotting. So usually blood clotting happens after, like in my video I said, usually blood clotting, which we call coagulation, happens after the injury of endothelial cell. When blood clotting happens in the endothelial cell inside the blood vessel, we call it thrombus or thrombosis. We need blood clotting because we need to stop the blood flow after the injury, but we do not need thrombosis because thrombosis blocks the blood flow inside the blood vessel. So we do not need thrombosis. Thrombosis is not good for our body. And some of the people experienced this thrombosis in their body in unusual part, like in cerebral thrombosis. Till then, there are no report why the thrombosis happens with administration of the vaccine. According to the report, 1 in around 50,000 to 100,000 1 in 50,000 to 100,000 shows this thrombosis inside artery or vein. This thrombosis happen to the people who have age less than 50. And also some reports says that this happened to more to female than male. Maybe in some countries this may vary with numbers. So this is the finding. These are the reports found related to AstraZeneca coronavirus vaccine. Apart from this, there were no report that a vaccine can create thrombosis. So after the report, what they did, they isolated blood from these patients who are showing that the thrombosis, and they found that their blood platelet level is very low. Their platelet count is reduced. And what else they found? They found an antibody which is against PF4, platelet factor 4. Now, who have known that the antibody against platelet factor 4, they immediately thought that this condition may be similar with another condition which is also related to antibody against platelet factor 4, that is called HITT. That means heparin induced immune thrombotic thrombocytopenia. We know that heparin is well established anticoagulant. In my previous video, I have told that heparin or heparin sulfate in endothelial cell, it binds to antithrombin. And after the binding to antithrombin, antithrombin cleaves thrombin, which is important for blood clotting. So when they inject heparin to the patient, this helps in blocking of clotting, blood clot. So heparin is used in several contexts to reduce the blood clotting or as a blood thinner. And after the injection of heparin, they found that heparin also binds to another molecule which is called PF4. This is platelet factor 4, which is secreted from alpha granule of platelet after the activation of platelet. This heparin is a negatively charged molecule, and this negatively charged molecule binds to a positively charged protein PF4. This is positively charged. So that is why these two molecules have high interaction. And after the binding, the platelet factor 4 changes its configuration, and our immune system recognizes this as a foreign molecule. So it produces antibody against this combination. And the constant domain of antibody, this portion is the constant domain, and this domain binds to Fc gamma receptor this domain binds to Fc gamma receptor of platelet, and after the binding of this antibody, the platelet gets activated. As I said earlier, that after the activation of platelet aggregation started. After the aggregation, it secretes more molecules from alpha granule and delta granule, and it also produces thrombus in your blood vessel. And after the activation also, the platelet count is reduced, and this condition is called as HITT. That means heparin-induced thrombocytopenia. Why thrombocytopenia? Because platelet is also called as thrombocyte. Because reduction of thrombocyte is called thrombocytopenia. So that is why the name is heparin-induced thrombotic thrombocytopenia. And this condition, which is related to vaccine, is also similar to this HITT. So that is why they named this condition as VITT, vaccine-induced immune thrombotic thrombocytopenia. VITT. This vaccine-induced immune thrombotic thrombocytopenia, VITT, is very much similar to HITT, which was previously established. Now the question is, who is causing the heparin-induced thrombotic thrombocytopenia-like symptom in patients after administration of vaccine? There are some reports that it can be the adenovirus or it can be protein. Till now, there is no definite report about who is causing this condition. So there are some hypotheses. They say that it can be the adenovirus itself is binding to PF4, because adenovirus itself has some negative charge. But again, the question comes, why only AstraZeneca vaccine is showing this kind of condition, and the similar type of vaccine is used by Johnson & Johnson. Johnson & Johnson shows very less as compared to AstraZeneca, and also another one is Sputnik 5. It also has similar kind of vaccine. Why only this kind of this vaccine has so many reports as compared to other vaccines? Another hypothesis is the DNA. The DNA itself is negative charged. It can also bind to PF4 because PF4 is positive charged. Again, same question is, why not other vaccines? And another hypothesis is this DNA, which contains spike protein of coronavirus, this DNA has, when this DNA is producing the RNA, mRNA, there may be some splice variants of this mRNA, which produces different kinds of spike proteins. And one of the splice variant is having spike protein. One of the variant of spike protein has high negative charge, and this spike protein is binding to PF4 like heparin. This can be in place of heparin. This can be a spike protein. Because spike protein also has negative charge, and this is creating immune response similar to the heparin-induced thrombotic thrombocytopenia. And similarly, this is creating antibody against these molecules, and the similar condition is happening, and the platelet is getting activated, and thrombosis is happening in the blood. Many people or many scientists and many doctors are accepting this hypothesis, and this can be a reason. And although there is no specific reason for this, still they think that this can be one of the reasons. Another report shows that when this vaccine is injected to mice in blood, in artery or vein, it shows similar kind of effect. It shows decrease in platelet and also thrombosis. But when this vaccine is injected in the muscle, there is no thrombosis, which also proves that when this vaccine is going into the blood, this is producing a spike protein variant, and this is binding to PF4, and this is creating immune response. But when we injecting this vaccine to muscle cell, there is no PF4 in the muscle cell, and this cannot create PF4 binding with the spike protein, and that is why this cannot activate our immune system, which also proves that when this vaccine is injected to people, there may be a chance that when they inject in the muscle, there may be contamination, there may be rupture of blood vessel near the muscle cells, and this vaccine is going into blood vessel and creating the spike protein and PF4 binding, and also activating immune system, and the anti-PF4 antibody is created. This also explains that why below 50 or younger population have this kind of symptoms, because younger population has high immune system. Then the question comes, why female have more effects, more occurrence than male? When they inject in muscle cell, there may be chance that female have less muscle cell, and the rupture of blood vessel is high in case of female than male, and this vaccine is going into the blood and creating antibody. Now question comes, what can be the treatment for this? As we know that this is creating thrombosis and creating clotting in our blood vessel, still we cannot inject heparin. We know that heparin is a well-known anticoagulant. Still we cannot inject heparin, because heparin is also binding to PF4. It may create similar condition and it may get worse. So what they need to inject? Because blood clotting needs vitamin K and also factor 10. There are some inhibitors, or there are some antagonists of vitamin K, and also some inhibitors of vitamin factor 10, those inhibitors can be injected. And we need to focus that we need to inject anticoagulant which is non-heparin. We do not need to inject heparin. And another treatment method is injection of high amount of IgG, immunoglobulin. When we inject high amount of Ig, this will bind and this will block these antibodies, and there will be no internalization of or activation of Fc gamma receptor of platelet. So this can help in recovering these patients. And another effective way how we can reduce this condition is while doing the injection, just taking out little of fluid in the injection to check that whether the blood is leaking or not. If there is no leaking of blood, then we will inject the vaccine, so that this vaccine will stay in blood, in muscle cell, it will not enter the blood. So if this is not entering into the blood, there will be no binding of spike protein to PF4 and there will be no antibody. So this is the most effective way till now, and some countries also have accepted this concept, like in Denmark. They have introduced this guideline that before injecting the vaccine, they need to check some fluid. If there is blood, they should not inject it. They have introduced this in their guideline to prevent the blood clotting. And also there some company, they are also working on this vaccine, on this splice variant, to remove the splice site of the mRNA or RNA, so that there will be no splice variants of spike protein. That can also help in future. So that is all about blood clotting of AstraZeneca vaccine. Thank you for watching my video. Bye bye.